Imagine for a second accidentally scratching an itch, right?
Yeah.
And your body's immune system responds to that by just permanently scarring that exact patch of skin.
Which is terrifying to think about.
Right.
Yeah.
Because for most people, a scratch just, heals and disappears. But if you are living with a chronic skin condition called lichen sclerosus or LS for short, that scenario isn't hypothetical at all.
No, it is the literal reality of your biology.
Exactly. So welcome to the deep dive. Today, our mission is to answer a highly specific, incredibly practical, and frankly, deeply frustrating question for anyone dealing with this. If you have lichen sclerosus, is it actually safe to get laser hair removal or a wax?
It is a question that sounds, pretty simple on the surface.
Yeah.
But when we look at the underlying cellular mechanics, the medical reality is incredibly complex.
Yeah.
Managing hair removal on compromised skin, well, it requires a fundamental shift in how you think about everyday grooming entirely.
Totally. And to figure this out, we are pulling from a really robust stack of sources today. On the clinical side, we have the 2021 European Guidelines for the Management of Vulval Conditions.
Right, heavy hitters.
Yeah, alongside the British Association of Dermatologists Guidelines. But then, to sort of balance out that clinical data, we have patient-focused, highly practical guidance from DermNet and the Lichen Sclerosis Support Network, or LSSN.
And that combination is just vital because clinical guidelines, they provide the pathology and the safety parameters.
Yeah.
But the patient networks are the ones who actually translate that data into, well, actual shower routines and daily management strategies for you.
Right, the stuff you actually do in your bathroom. But before we get into the actual mechanics of pulling or zapping hair, we really need to set the stage for you. So lichen sclerosus is this chronic inflammatory skin disease, and it has a strong autoimmune link, right?
Yeah, absolutely.
And it most commonly affects the anogenital area. So at a cellular level, your immune system is essentially attacking the basement membrane.
Which is basically the biological glue that holds your skin layers together.
Right, the glue.
And the physical result of that immune response fundamentally changes the architecture of the skin itself.
Yeah.
The tissue loses its elasticity. It often turns this distinct porcelain white color due to sclerosis.
Which is what exactly?
It's essentially a thickening and scarring of the connective tissue.
Oh, wow.
But ironically, while that connective tissue thickens up, the very top layer of the epidermis becomes paper thin. So it can become, maddeningly itchy, and it tears incredibly easily.
Okay, let's unpack this. Because before we can even evaluate a razor or a laser, we have to understand how LS-affected skin reacts to the outside world in the first place.
We really do.
We have to look at, the golden rule of this entire deep dive.
To do that, we actually have to travel back in medical history a bit.
Oh, I love the history stuff.
Yeah, back to 1877 to a dermatologist named Heinrich Kobner. Because he observed a biological phenomenon that, frankly, dictates everything about managing LS. It's called the Kogner phenomenon, or the isomorphic response.
Let's break that term down for a second, because understanding the isomorphic response changes, pretty much everything. So iso means equal or the same, right?
Right.
And morphic refers to shape or form.
Exactly. And what's fascinating here is how that actually translates to the patient experience.
Right.
The Kobner phenomenon occurs when you have a pre-existing dermatosis, like lichen sclerosus. If you experience even minor physical trauma to a completely healthy-looking area of skin in that susceptible region.
Okay, it's a scratch.
Right, like a scratch. That trauma actually triggers the development of a brand new disease lesion in that exact spot.
Oh, wow.
And the new lesion takes the same form, the isomorphic form of your underlying disease.
So instead of just healing a minor cut or a scrape like normal skin would, the skin uses that trauma as a catalyst to basically pull the underlying autoimmune disease straight to the surface.
That is exactly it.
To visualize what is happening on a microscopic level, think of it kind of like a highly sensitive, overly aggressive home security system.
Well, I think.
So in LS, the immune cells, which are like the security guards, they're constantly loitering just beneath the surface of the skin, right?
Yes.
Highly agitated, totally on high alert.
That is the perfect analogy. Because when you introduce a trauma, which is essentially just bumping a window,
Right.
those immune guards rush the breach. But because their programming is flawed by the autoimmune condition, they don't just, repair the glass.
They freak out.
They go into complete lockdown. They trigger this massive inflammatory cascade, and they start laying down concrete to reinforce the entire area.
And that concrete is the sclerosis.
Exactly. The painful scarring that characterizes an LS flare.
And the medical texts are very, very clear that this window bumping, it doesn't have to be a major injury at all.
Not at all.
Like, we aren't talking about deep surgical incisions, though, obviously those are triggers too. The sources note the triggers can be almost invisibly small. A tight waistband just rubbing against you as you walk,
Yeah.
scratching an itch in your sleep, or, crucially for us today, the trauma caused by routine hair removal.
And when you realize the immune system is operating on that kind of hair trigger, well, the idea of applying mechanical force or heat to that paper-thin epidermis, it changes from a routine chore into a literal biological minefield.
Seriously. So if the skin reacts to even invisible trauma, we really need to look at what happens at a microscopic level when we use traditional grooming methods.
Right.
The patient advocates at the LSSN, and specifically Dr. Sin, who authored these highly practical guidelines, they break down a hierarchy of harm for hair removal. Let's start with the ancient methods, like sugaring.
Yeah, so sugaring is this technique dating all the way back to ancient Egypt. Use a really simple paste made of sugar, lemon, and water.
Sounds nice, honestly.
It does. And from a biochemical standpoint, it actually is slightly safer than standard waxing
Okay, why is that?
because the sugar paste binds selectively to the keratin in the hair follicle, rather than sticking to the live epithelial cells of the skin itself.
Oh, I see. So it acts as sort of a gentle exfoliator without adhering to the fragile epidermis.
Exactly.
Right.
But, and this is a big but, the guidelines still heavily caution against it
Right.
because the mechanics still require forcefully uprooting a hair straight out of its follicle. You are still physically ripping something out of the skin, which absolutely constitutes physical trauma.
And that trauma is just amplified significantly with traditional waxing, right? Because hot wax adheres directly to the top layer of the skin.
Yeah, it grabs everything.
So the mechanical force required to rip the wax away, combined with the literal thermal heat of the wax itself, it damages skin that is already compromised.
Oh, totally.
You are practically guaranteeing micro tears in that paper-thin tissue, sending a massive distress signal to those hypervigilant immune guards we talked about.
You're just smashing the windows.
Exactly. But I want to push back on the sources for a moment here, or at least just explore a conclusion that initially seems really counterintuitive to me.
Okay, let's hear it.
If waxing literally rips the hair out by the roots and sometimes takes a layer of skin with it,
Yeah.
how do the LSSN guidelines conclude that shaving with a razor blade is actually the worst method for lichen sclerosus? Doesn't a razor just, skim the surface?
It's a great question, and it really comes down to the cumulative biology of friction. It's chronic versus acute trauma.
Okay.
Think about the physical mechanics of shaving, especially with modern, multi-blade razors. We call it skimming the surface, but on a microscopic level, it is highly, highly destructive.
Because of the blades.
Yeah, there was a concept in razor design called hysteresis.
Hysteresis.
Right. The first blade pulls the hair up out of the follicle. The second blade shears it off. Then the hair snaps back down below the skin line. Meanwhile, the third and fourth blades are essentially dragging across the stratum corneum, literally scraping away protective layers of skin with every pass.
Wow. Okay.
And the really critical factor here is frequency.
Right, because you shave often.
Exactly. Waxing is an intense acute trauma, sure, but it's an isolated event. You endure the trauma, and then the skin is left alone for 4 to 6 weeks to recover.
Right.
Shaving creates continuous, daily microcuts. It is relentless, repetitive friction. You literally never give that hypersensitive immune system a chance to stand down.
Oh, I get it now. That constant low-grade trauma keeps the inflammatory cascade permanently switched on, which just fuels chronic Kopner responses.
Exactly.
Okay, framing it as a chronic friction issue makes the clinical stance completely logical. But the sources also acknowledge the reality of patient lives, right? Like whether for cultural reasons, sensory comfort, or just personal preference, some people are going to wax.
They absolutely are.
And if you find yourself in that position, the LSSN provides a really strict mitigation strategy.
Yes, and the foundation of that strategy is completely non-negotiable. You must never attempt waxing during an active LS flare-up.
Right.
The skin has to be completely calm and in remission.
Furthermore, they advise against DIY home waxing. You need to find a professional, and specifically one who actually understands compromised skin barriers.
Which is so important.
Yeah, because the professional must apply a protective oil barrier to the skin before the wax is even applied.
Right.
This creates a lipid buffer, ensuring the wax only grabs the hair, minimizing the pull on the epidermis, and then it has to be followed immediately by a calming afterbalm to soothe the localized inflammation.
So we've established that shaving causes chronic friction, and waxing is this high-risk mechanical trauma,
Yep.
which leaves us with modern technology. If scraping and pulling summon the immune guards, what about light and heat?
And this brings us to a really fascinating contradiction in the stack of research. It is the laser hair removal paradox.
It's so interesting.
Right. If you read the DermNet clinical files on the Koebner phenomenon, they explicitly list laser hair removal as a known disease trigger because the mechanism of a hair removal laser is selective photothermolysis.
Yeah, big word.
Basically, it targets the dark pigment, the melanin in the hair follicle, converts that light energy into heat, and essentially cooks the stem cells in the hair bulge.
Wow.
And that intense heat is a thermal trauma.
Right, and that heat damages the surrounding tissue just enough to trip the alarm system. It is a fully documented trigger for an LS flare.
But when you look at the patient advocacy side, Dr. Sin and the LSSN explicitly call laser hair removal a great option.
They do.
So how can a known autoimmune trigger simultaneously be recommended as a great management option?
Well, if we connect this to the bigger picture, it is a calculated trade-off.
Okay.
You are accepting a short-term controlled risk for a permanent long-term payoff. During the 6 to 8 sessions required for laser hair removal, the thermal trauma might cause temporary irritation or a mild localized flare.
Right, it's going to hurt a bit.
It is. But once those sessions are complete, the follicle is permanently disabled. The hair just stops growing, or it grows back so fine that it is negligible.
And by taking that calculated risk up front, you completely eliminate the lifelong need for daily shaving or monthly waxing.
Exactly.
You permanently remove the mechanical friction that causes the continuous chronic Koebner responses. So the dermatologists are warning about the immediate thermal trauma, while the advocates are looking at the lifelong relief from daily friction.
It's all about playing the long game.
Here's where it gets really interesting, though. We just established that the thermal energy from a hair removal laser can trigger the disease, right?
Yeah.
But the 2021 European guidelines highlight that an entirely different type of laser, the fractional CO2 laser, is actually being clinically studied as an experimental treatment to heal lichen sclerosus.
It sounds wild, but the underlying mechanisms of these two lasers are completely different, which perfectly explains the paradox. Well, a hair removal laser targets pigment to destroy a follicle, like you said,
Yeah.
but a fractional CO2 laser is an ablative technology,
Meaning what?
meaning it doesn't target pigment at all.
Yeah.
It vaporizes water in the tissue, punching these microscopic columns of thermal injury straight into the skin while leaving the surrounding tissue perfectly intact.
Okay. And the theory behind the fractional CO2 laser is that this specific type of controlled microinjury forces the tissue to generate heat shock proteins.
Right.
It stimulates fibroblasts to produce brand new healthy collagen and elastin. So it is actually attempting to remodel the scarred sclerotic tissue from the inside out,
It's incredible.
basically reversing the architecture changes caused by the autoimmune attack.
The clinical irony is just profound. One laser risks a flare-up by destroying hair, while another uses thermal injury to force the skin to rebuild itself.
It's wild.
It is. However, we have to look really closely at the medical consensus here. While some small, localized trials have shown, promise in reducing pain and improving tissue elasticity with the CO2 laser, both the European guidelines and the British Association of Dermatologists are very hesitant.
Because they state that currently there is no high-quality, randomized long-term evidence to support recommending laser therapy as a standard treatment for LS.
Right, exactly.
While it holds promise in experimental settings, it is definitely not the clinical gold standard yet.
So, returning to the practical application of laser hair removal, the sources emphasize a very strict medical caveat.
Right.
If you decide the permanent removal of friction is worth the short-term risk, well, timing is your most critical tool. You must only undergo laser hair removal when the lichen sclerosus is in total remission.
That makes total sense.
Applying thermal trauma to an active flare is just guaranteed to worsen the sclerosis.
And there is also a really brilliant, highly specific tip from the LSSN regarding timing that sort of bridges endocrinology and pain management.
Oh, this is a great tip.
They strongly advise scheduling your laser sessions around your menstrual cycle. Specifically, avoid going while you are menstruating.
And the physiology behind that recommendation is incredibly solid. During menstruation, your body naturally releases prostaglandins, which are lipid compounds that promote inflammation and, uterine contractions.
Right, the cramps.
Yeah. But these compounds also heighten systemic pain sensitivity across your entire nervous system.
Oh, wow. So if you are already dealing with paper-thin, hypersensitive skin due to LS, and then you add the localized thermal pain of a laser, plus the systemic nervous system sensitivity caused by prostaglandins.
You are setting yourself up for a truly agonizing session.
Yeah, that sounds awful. Timing the laser to avoid your cycle just minimizes that physiological distress.
Totally.
So, we have navigated the clinical paradoxes, the friction mechanics, and the Koebner phenomenon. Moving from the clinical theory to your actual daily reality, how should you actually manage your routine?
Right, the practical steps.
So, what does this all mean? If we distill the absolute best advice from the top European dermatologists and the daily lived experiences of the patient advocates, the medical gold standard for grooming with lichen sclerosus is remarkably simple.
It really is.
Leave it alone.
Simply leave it alone. Pubic hair is not a cosmetic flaw, you know. It serves a vital biological purpose.
Right.
It acts as a natural friction buffer. It protects the delicate skin of the vulva from the micro-traumas of daily life, the rubbing of clothing, the friction of walking, the irritation of sweat.
Yeah.
By leaving the hair intact, you utilize the body's natural defense mechanism and completely bypass the risk of a grooming-induced Koebner response.
But, acknowledging sensory realities, many people simply find the natural length uncomfortable.
Of course.
If leaving it entirely alone just isn't an option for you, the safest, expert-approved alternative is an electric trimmer. But the technique here is absolutely crucial.
It is. You cannot just press the trimmer flat against the skin the way you might when buzzing a beard. You must use a guard attachment, or utilize what they call the hover method. You carefully hover the trimmer above the skin surface, giving the hair a trim without the oscillating metal blades ever making physical contact with the fragile epidermis.
Right. You achieve a comfortable length while entirely avoiding that mechanical friction.
Exactly.
And this mindset of extreme gentleness has to extend beyond hair removal and into basic hygiene too.
Oh, absolutely.
The sources provide incredibly specific daily maintenance tips for the shower because the Koebner phenomenon doesn't distinguish between a razor and a washcloth.
Not at all. Trauma is trauma.
Exactly. So the days of using a loofah or a standard terry cloth washcloth are just over. The woven loops of terry cloth are way too abrasive and can cause micro tears on LS-affected skin.
So the LSSN actually recommends washing with just your bare fingers, but they add a really critical biomechanical warning to that.
Which is
You have to ensure your fingernails are meticulously filed and smooth. If a sharp edge of a fingernail accidentally nicks that paper-thin skin while you're washing, you have breached the security system.
right, and triggered a localized flare.
Exactly.
To eliminate that risk entirely, the patient network suggests two fantastic alternatives. The first is utilizing newborn baby washcloths.
Which is brilliant.
Right. The fabric is specifically manufactured to lack the abrasive loops of standard towels, making it totally safe for skin with compromised barrier function.
And the second suggestion is just a real testament to the practical ingenuity of patient communities. They recommend using baby scratch mittens.
I love this one.
Yeah, the small, smooth cotton mittens designed to prevent newborns from scratching their faces. By wearing a mitten in the shower, you cover your fingernails completely,
Yeah.
providing this frictionless, ultra-soft surface for washing that entirely removes the risk of an accidental nail nick.
It perfectly solves the biomechanical risk. But, as we synthesize all these practical strategies, we really have to underscore the foundation of all of this care.
You do.
Because the perfect trimming technique and the softest baby mittens are useless if the underlying autoimmune fire is still just raging.
Exactly. Managing the external friction is completely secondary to managing the internal disease.
Right.
The absolute bedrock of lichen sclerosus care is strict adherence to your medical treatment plan. For the vast majority of patients, the clinical gold standard is a regular, consistent routine of ultra-potent topical corticosteroids, such as clobetasol ointment, combined with generous emollient use.
And the clobetasol works on a cellular level, right? It penetrates the skin barrier, enters those hypervigilant immune cells we talked about, and literally downregulates the genes responsible for producing inflammatory cytokines.
Right. It basically tells the security guards to stand down and go back to the barracks.
I love that.
And by suppressing that localized immune response, the inflammation halts. Over time, consistent steroid use can actually help the skin reverse some of the sclerosis, regaining a degree of normal thickness and resilience.
Wow.
And when the disease is brought into clinical remission, the Koebner phenomenon is just much harder to trigger. making every single grooming or hygiene choice vastly safer.
To bring this all together, our mission today was to navigate the really complex reality of grooming with compromised skin. And the biological bottom line is that you just have to respect the extreme fragility of the
You
epidermis.
really do.
You have to constantly beware the Kubner response, that isomorphic trigger that turns a microscopic scrape into a painful, scarring flare. Shaving causes relentless chronic friction. Waxing is an acute mechanical trauma.
Yeah.
And if you choose the laser route, you are making a calculated trade-off. You're accepting short-term thermal irritation to achieve a lifetime free of friction, provided, of course, you time it perfectly during clinical remission.
Right, because every single decision revolves around mitigating friction and minimizing trauma to a barrier that is already under siege from within.
Reviewing the mechanics of the Koebner phenomenon, it really leaves us with a profound realization about human biology. It proves that our skin possesses a highly aggressive physical memory for trauma.
It really
It
does.
records and reacts to every insult, no matter how small.
And when you zoom out from lichen sclerosus and look at the broader landscape of the beauty and grooming industry,
Yeah.
it forces a massive shift in perspective. Society normalizes incredibly harsh cosmetic routines.
Oh, absolutely.
The aggressive chemical exfoliants, the forceful ripping of waxing, the daily multi-blade scraping.
It makes you wonder, how much of our quote-unquote normal everyday grooming is actually just a continuous barrage of microtraumas?
Right.
Even for those without a diagnosed autoimmune condition, our bodies are likely silently fighting against these routines every single day, expending cellular energy to heal the invisible damage we just casually inflict in the name of aesthetics.
It definitely changes the way you look at that razor sitting on the edge of the tub.
It really does. Well, thank you so much for joining us on this deep dive. Keep questioning the biology behind the things you do every day. And remember, sometimes the most profound thing you can do for your body is to simply leave it alone. Until next time.